Hello, everyone. Rather than make you read yet another long article, I thought I would share my personal reflection on ADHD in early childhood from a mother's perspective via webcam. Hopefully, it'll be a little more entertaining than just reading text. My son Ethan was diagnosed with severe ADHD at the age of 4 because he fit the strict definition of criteria for the disorder after a 4-hour psychological evaluation, including an IQ test for children, an interview with both parents and child, and many self-reported, well, in this case it was parent-reported, questionnaires regarding his behavior and how he kind of managed his emotions at the time. Keep in mind he was 4 years old at this point. In addition to the severe ADHD diagnosis that we received at that time, his clinical psychologist suggested that Ethan may have comorbidity of bipolar disorder and oppositional defiant disorder, or ODD. We did see a lot of the ODD type symptomology if we're talking about a medicalized perspective here of this sort of childhood behavior. But for bipolar disorder, we were particularly confused because bipolar disorder is not necessarily a diagnosis that you see in children. In fact, most psychologists and psychiatrists won't diagnose bipolar disorder in children at all, let alone in a child that was 4 years old. So knowing that, we were really challenged with kind of understanding really what was going on with Ethan. We knew that, there were issues there, but even with that evaluation, we didn't have all the answers. And there's a lot of this story that came before. In congruence with similar diagnostic courses of ADHD, we were first notified by his teacher in preschool at age 3 that there might be a problem. Ethan was very active, sometimes aggressive, and very impulsive. As a family, we believed, like many parents who struggle with the potential ADHD label, that this was typical boy behavior, and he would grow out of it when he learned to communicate and manage his emotions. The reason we actually realized something was going on, I walked into his preschool classroom, and all of the children were outside playing, including Ethan, with another caregiver. And his teacher was alone in the classroom, and she was crying. And I walked up and asked her, what's going on? Is everything okay? And she looked at me and said that your child is one of only 2 children who have ever made me cry. And I knew that she was a great teacher. So I knew in that moment that something was wrong. And I wanted to place the blame on anything but some disorder with my child. Of course, we don't want it to be our child. But I couldn't deny the fact that she was an educator and she recognized that something was going on. So yeah, we thought, Ethan's going to grow out of this. But unfortunately, like the majority of children who legitimately have ADHD, left untreated from age 3 when we finally recognized that something was going on. Ethan's problems became more and more severe in school, in childcare, at home, and eventually just every context. He became aggressive, hitting and kicking children and adults. He punched me in the face when he was 4 years old. He was asked to leave a daycare center after his extreme behaviors did not subside, and the center refused a treatment plan without some sort of psychological evaluation. The problem with that is there aren't a lot of medical doctors who will do a full psychological evaluation on a very young child, particularly younger than 4. So eventually when Ethan reached pre-K at a public school and was unable to complete even a half day at his public school without an aggressive outburst, we sought an evaluation. And what I mean by this is on day 1, without giving much context to his teacher, I got a call after school that something was wrong. Ethan's behavior was not typical of the other children in the class. And I think at that point I recognized that we needed this evaluation. We needed to know what was going on. I had multiple educators, counselors, teachers, daycare center providers, and directors telling me something's not right. And there's so much denial as a parent. You don't want to say that, this thing could be affecting my child. So we sought the evaluation, and this led to Ethan's first diagnosis and straight to a psychiatric nurse practitioner who prescribed him Adderall, a stimulant medication, and Risperdal, an antipsychotic. We had been trying counseling for about a year up until that point, but we weren't seeing very effective results. It's kind of hard to do much in the way of counseling with a 4-year-old. So the play therapy was ultimately what we were doing, and it was not proving to be very effective at that time. Immediately upon beginning the medication, Ethan's behavior began to reflect that of typically developing children his age. It was the quick fix that every parent seeks. With the medicalization of what was deemed collectively as deviant childhood behavior, we now had a label for Ethan. And suddenly, teachers, administrators at his school, and doctors began to treat Ethan and us differently. Upon the realization that this new disorder could be treated with amphetamines, we were encouraged to continue giving Ethan these very potent medications for which there truly is no longitudinal data regarding effects on brain function and development, particularly in children as young as Ethan. Eventually, after a year on medications and as his behavior normalized in comparison to his peers, we decided to wean him off of his medication to try alternative therapies, including play therapy and reward-based parenting plans and reward-based plans in school at the suggestion of counselors. And we had a lot of pressure from family members, extended family members in particular, to get Ethan off of these very strong medications because we were all sort of worried about what could happen long term if he stayed on these medications. So just to reflect sort of on some of the theoretical components of this regarding deviance, referring to Conrad's article in, I believe it was module 1 or 2, medical reclassification of these deviant behaviors allows for these alternative methodologies in response to the behaviors. So that is, were ADHD or hyperkinesis, as it was referred to by Conrad, not recognized formally by the medical community, these behaviors would require some other social control, assuming that the behaviors have been defined as deviant within a social context. So, in terms of education, Ethan was routinely suspended or, in one case, expelled for his inattention or aggressive tendencies. Whereas, with a medical diagnosis, there was a sudden response from his school for him to participate in special education programs, including a Section 504, which is basically it's kind of just like a behavior intervention plan. They have a special assigned seating for Ethan and things of that nature that sort of help him function more effectively in the classroom environment. And we had lots of modifications for students of his age suffering from ADHD. Some of his modifications included frequent breaks, reward systems for positive behavior, and preferential seating, which often involved Ethan sitting upside down in his chair, or spinning around in his chair, or laying on the floor, while still actively engaged in educational activities. I remember having conferences with his kindergarten teacher at this point, and she told me that Ethan was doing pretty well, and he was a wiggler, and he as long as he had a job and stayed busy, he could be upside down with his head hanging off the chair, spinning around. But if she asked him a question about the group instruction that was going on, he could answer the question. So he was aware, but his body just was moving nonstop. So kind of going back to the medication, we started weaning Ethan off the medication early in the school year for kindergarten. So he had been on the medication for about a year. So we were, at this point, relying solely on the 504 at school and our plans of action at home and counseling. And Ethan immediately, upon even the doctor prescribed sort of the weaning off of the medication. And even with his orders, Ethan began to suffer from extreme withdrawal symptoms. He first stopped taking the Risperdal, which was the antipsychotic, and he experienced significant side effects of the Adderall, which he was still on because he was weaning off of the Adderall and was taking a bit longer. He began to have constant vocal tics, full body dystonia, which is basically where you don't have control over your body's movements. So we're talking like full body tics. Ethan was unable to walk, and I'm not exaggerating. He would have to stop walking every couple of seconds and bend over. He was heaving with his chest, and he would tell me he had trouble breathing. And as a mother, I mean, this progressed over a period of 2 weeks from just, a sniffle as a tic to we're talking trouble breathing, chest pain, and full body dystonia within a 2-week period, at which point we rushed Ethan to the emergency room because we were terrified and we had no idea what was going As a parent, I was never warned that these effects could arise from the medications that were supposed to be making his life better. Eventually, after many visits with psychologists, neurologists, Ethan's side effects and symptoms decreased. For a lot of children who have taken Risperdal, the antipsychotic, those sorts of effects, such as the dystonia and the tics, sometimes they never go away. And I was never told that that medication could cause my child to have, tics and dystonia for the rest of his life when he stopped even if he stopped taking it. We were lucky in that things got better for him, and now it's been a little over a year after he stopped taking the medication. He now suffers only from occasional vocal tics. His behavior with play therapy and educational modifications, parenting models for children with ADHD, all of those sorts of things combined was always a partnership between parents, families, school, all teachers, administrators, his counselor, always an open conversation with all of us about how we can work together to help Ethan be successful throughout kindergarten and now first grade. So at 6 years old, this year in first grade, Ethan was reevaluated by a clinical psychologist, same clinical psychologist, a new battery of tests. And he has now been diagnosed again with ADHD severe, along with autism spectrum disorder, once labeled high functioning autism or Asperger's. So those two diagnoses together make much more sense to us as a family, to his educators, to counselors, in the context of Ethan's behavior. We don't necessarily see the bipolar disorder. We do see some of the oppositional defiant disorders still. That sort of coincides with ADHD. But there is a lot of overlap in these conditions, and it's really difficult to identify, where one ends and where one begins. So we don't really know, how much of Ethan's behavior comes from ADHD and how much of it comes from Asperger's. Again, with a recent increase in his ADHD behaviors, his teachers, counselors, and psychologists have recommended that we attempt medication. He has become aggressive, impulsive, hyperactive, inattentive to an extreme degree. In some ways, he has internalized his ADHD label, and he knows that is the reason he behaves the way he does. He's very intelligent. He's in first grade, and he's reading at a fourth grade reading level. And he will often manipulate adults by telling them about his disorder as though it somehow excuses his deviant behavior. Many adults are, of course, empathetic, but what do you say for my son who was labeled a deviant at age 4? Is this label ultimately going to lead him on to a life of secondary deviance and this self-fulfilling prophecy of just deviant behavior and comorbidity of other mental illnesses, etc., or judicial issues and things of that nature as he gets older? Or is he going to persevere in spite of the label, thanks to positive modifying influences and the strong attachments to his positive social networks? He's got a great family, and we all support him a great deal, but we don't know where this path leads. We as parents are left in a situation where we as parents must decide how to treat the children. Will there be severe side effects with some new medication? What will happen to my son's brain if he takes medication long term? What if he suffers comorbidity later in life of depression, anxiety, as an outcast from his peers and his educators because we didn't give him medication that he truly needed? There is no consensus about what ADHD is, how long it might last, and how we should treat children who suffer with the disorder. As a mother, I am left to defend my son's diagnosis at every turn. Many educators, family members, and friends suggest that Ethan may just be reactive to issues in his parents' life, reactive to issues in his life, including his parents' divorce, leading to behaviors that might mimic the disorder of ADHD, but aren't necessarily extreme enough to be diagnosed. Meanwhile, my son is left non-functional as we are torn deciding what the best course of action should be. The impetus really should be on doctors, parents, and educators to document the behaviors they're seeing and sort of manage their expectations for children in early childhood when intervention is vital to long-term positive health outcomes. So in the future, we don't know if Ethan will take medication. We don't have the answers. He's 6 years old, and I'm, as a mother, left in a position to make this decision. So with that, I'll leave you, and hopefully I gave you some insight into a personal experience with a family struggling with a diagnosis of ADHD. Thanks for watching.